Dr. Mayberry here, continuing our discussion of the vertebrae. This video is going to talk about lumbar vertebrae. So the lumbar, think lumbar lower. We're talking about not the lowest vertebrae, but these lower vertebrae here. There are 5. So L1 through L5. These are just above the sacrum. So the sacrum will be the next vertebrae we talk about. So lumbar vertebrae are quite different looking from the cervical or the thoracic. And one of the biggest differences that you see as you move down through the vertebrae is actually the size of the bodies. So the vertebral bodies get larger as you move down the spine. And the reason really is that the body is heavier as you move down. So the cervical vertebrae only have to support your head, but as you move down the spine, they have to support more and more weight. So the bodies do get larger. We also see changes in the transverse and spinous processes, and that's for muscle attachments. So, your spine moves differently depending on the region. So the spinous process of the lumbar vertebrae is very, very differently shaped than it was for cervical or thoracic. So we say this is a hatchet-shaped spinous process, and that's one of the easiest ways to recognize the lumbar vertebrae. We also have these really protrusive, I guess you could say, transverse processes. So they're sticking out really far. They do not have costal facets on them because we don't have ribs that are articulating with the lumbar vertebrae. So we have the transverse processes, the spinous processes. We have superior articular facets that have shifted in location as well. They're a little bit curved, which is unique to the lumbar vertebrae. And then we have these inferior articular facets. So if you're looking at the posterior side of the vertebrae, flip it, those are those inferior articular facets. So if we look at the lumbar vertebrae all articulated, they fit together like this. So they have altered form a little bit. We still have our vertebral foramen, which means that this is really still the vertebral arch, even though, again, it is different looking than it was before. So that really sums up the lumbar vertebrae. So hopefully you understand what I'm talking about when I say that there's not a lot of variety in the landmarks that you need to know. So it's not too bad for the lab practical there. So just be sure that you can identify all of these landmarks. The sacrum will be a little different. We'll cover that in the next video. So I will see you there.